Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning, good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And we're going to get a little serious today, although I know we're going to have a lot of giggles, but we're going to be talking about a very serious subject, and that's mental health. And it's very serious, and it is something that we do not talk about enough. And when we do, we go, right? And we shouldn't do that. We should not do that. And so please join me in welcoming my guest today, Janelle Miller Moravek. Welcome, Janelle. How are you?
I'm good, Deb. Thanks. I'm happy to be here.
Yes, we are going to have a great discussion. So let me tell people a little bit about you, and then we will jump into this. So Janelle Miller Moravek is a champion for youth and family counseling's mission of opening doors to mental health care so people can heal and thrive. The executive director since 2009, she is responsible for overseeing programming, administration, and strategic plan implementation while representing the organization to community partners and other stakeholders. Her vision, leadership, and passion for improving access to mental health care have steered YFC's steady growth over her 15-year tenure. And I have to admit, the organization is as old as I am. We won't tell how old that is. People can look that up. But it's been around a really long time, providing fabulous treatment and services to people who need it. So again, Janelle, welcome. How are you?
Oh, I'm good. Today's a good day. Thanks for asking.
It is. The sun is shining, all sorts of good stuff, right? In fact, it's shining here. I don't know, might not be in Chicago.
Ish. A little, yeah.
They're saying 90 here before a day or two. And of course, that's like, 112% humidity. So that'll be fun. Yeah.
Send some this way.
Yes, I know. Whoosh, whoosh. Well, you get that lake effect snow, and we don't get that. So that's
Oh, true.
Yeah,
True.
Yeah. Well, you have had a wonderful career that has made such a difference. But tell us about how you got to where you are today.
Deb, it was kind of an accident. We were chatting before the show, and I shared that I was a French studies and international relations major in college. And my plan, I was going to go to graduate school in France, and I was going to meet a Frenchman, and I was going to stay there. That was my plan, right? That was my plan. And then I fell in love with a guy, and he was getting ready to be a high school football coach.
And not in France.
And they don't have those in France.
No.
So
Soccer. Don't they play soccer there?
They do. They play soccer. Yeah. So I thought, I can do something else, but I don't know that I'll find another true love. So pivoted and ended up getting jobs in fundraising, which was where I had landed as a work study student in college. So I was assigned to the development office and liked it. And so just kind of kept going because that's where my resume was. So I just kept going and did fundraising, started off doing the marketing part of it, which is the annual fund, did some corporate relations. And then I was excited. I got to be sort of a director and put together a new program. And that was exciting. And then I was ready to do something else, something like start a family. And I decided I didn't want to work, 60 hours a week and always be dressing up. So,
and in a nonprofit, that's it.
Right. And so I happened to find a part-time fundraising job, which isn't that easy in the Chicagoland suburbs. So I found a part-time fundraising job for this little counseling organization. Their budget was $600,000 and I was their first ever development director. I
Wow.
worked 20 hours a week
Mhm.
and I loved it.
Mhm.
I loved the people. I loved the clients. I saw the work.
Mhm.
Um, and I think I kind of grew up with YFC.
Mhm.
That was in 2000 that I
Mhm.
started there.
Mhm.
Had my babies. They came to work with me for their first months. And when the executive director stepped down in 2009, I said to the board, I would love that job.
Mhm.
And here's why. Here's what I would do.
Mhm.
And they were like, oh, that sounds great. Go for it.
We don't want to have to do a search.
Right?
They
And
knew you and trusted you. That's the more
they
important
did.
thing.
They did. Yes. Because I had worked closely with them.
Right. Mhm.
So I stepped into the role, and today we're a $2.8 million organization with 3 locations across
Mhm.
Lake County.
Mhm.
And I still love my job and I'm still learning
Mhm.
every day. And just like you try to help people learn, like I'm like,
Mhm.
I've learned the hard way. I had no training for this.
Mhm.
It doesn't have to be this hard.
Right.
Can I just tell you?
Mhm.
Here's how you do it.
Mhm.
And so I find myself doing a lot of talking about what it's really like and all the things that I've learned about mental health and accessing mental health and what it means to run a mental health practice
Mhm.
and to support the people
Mhm.
who are helping
Right.
provide those mental health services.
Mhm.
So I feel like there's a lot I can talk about.
Mhm. I love it. I love it. Well, let's just jump into the meat of this, the elephant in the room, the whatever we want to call it. Mental health still continues to be the thing, and I mentioned this at the start. We ignore it. We don't want to think it exists. We certainly don't want to talk about it, and we really don't want to think that it might be in our family, in our workplace, things like that. And of course, it is.
It totally
And
is.
yeah, and because we ignore it, what happens is it's made worse. And I was sharing, before the program that I am a 3-time cancer survivor, and I am treated very different in the workplace than someone who would have mental health challenges. They're going to make accommodations for it. First of all, they're going to believe, right? Because a lot of it is really, no, you're just having a bad day. All of those various things. They're going to look at me and go, oh yeah, you're sick. And mental health is a disease just like cancer, just like everything else, but we still don't treat it that way.
No. In fact, our system isn't equipped to deal with it before it becomes a crisis. And as a community, as consumers, I don't know when I learned if it's a gaping wound that you need stitches. I think I was pretty young, right?
Right.
And
You fix it. You fix it now.
right. Well, and I know where to go. I know,
Right.
I know today that I can go to the urgent care for stitches. I can probably wait until the pediatrician opens to talk about the 102 fever. And that if it's something cardiac related or,
Yeah, that might be an ER.
I think I've got to go to the ER. But we do not have that. I'm going to call it literacy for mental health. So we don't understand, I think, as a culture, a society, what that looks like in us, much less other people.
Right.
And we don't understand what that means. And then because it's really scary, people are very hesitant to deal with it, to talk about it. And I think that's too bad because it's really just getting in the way.
Right. And what you said is me, right? I don't recognize the signs that someone might be having a mental health issue and until it becomes the crisis, right? Where, there's violence, there's self-harm, there's all of those various things. Whereas if I would have known what to look for in advance, maybe I could have helped. Maybe I could have said, hey, you need some help. So, especially in the workplace, because that's where it gets really tricky, because there's laws, you can't talk about these things, all of that. What are suggestions you have for people if they're concerned about a coworker?
Well, if they're concerned about a coworker, I think corporate would say tell HR. Um, I have my own theories about if that's an effective strategy.
Well, because that's several levels and layers that are going to be added in. And in a lot, I mean, let's compare it to the bleeding wound, right? Are you going to say, hey, go tell somebody down the hall who might be in a meeting that this person might need stitches? No.
No, you're not. Right. So I think that if you see a coworker who's struggling, ask, like, are you okay? And then listen to what that person says. And at some point, depending on how well you know the person, they may or may not tell you, right? But there's this great resource that we have. It's a new resource. It's called 988. It's that national,
the national number.
The national number. Anybody can call that. There are trained people on the other end of the phone, and you can call for yourself, but you can also call because you're worried about somebody else and get coaching from trained professionals. So I would say ask. And then if you're really worried, 988 is a great resource.
Right.
And here's the great thing about 988. Most of those calls, if they're not able to be resolved over the phone, most of those calls result in a visit by a crisis response team that includes a peer recovery specialist, so someone with lived experience, and a professional, which is great.
Right.
Yeah. But I think can we go back to, I think there's a lot that we can do as a society to set up. And I think about how we are on top of diabetes or cardiovascular disease or cancer. Right? Well, we have screenings. There are public awareness campaigns about what the
We've got breast
symptoms
cancer awareness
are.
month.
Right. And there are screenings that your doctor does and that we do regularly. But I don't know the last time that anybody got a regular screening for mental health was. And in fact, it was just January of this year that commercial insurance covers an annual mental wellness screening, evaluation every year. So we don't have it built into our systems. We don't have effective referral mechanisms. We have I want to say uneducated, but that's not what I mean. I mean, they just don't know. They're uninformed.
Naive, maybe is the.
But they don't know the levels of care and how to navigate them. We also have a workforce shortage.
So we're going to ignore what we might be seeing.
Well, and the person may have reached out for help, but because there aren't enough providers, they might not have been able to get it. And it's not exactly a cohesive system, the behavioral healthcare system. It's a scatterboard. So, for example, someone might present at an emergency room because they're in crisis. They may get sent to that hospital system's, doctor system, physician system for an intensive outpatient partial hospitalization program as a step down. But then that system may or may not have the psychiatric care, the outpatient care. So they might have to refer that person to a private provider. But then that private provider also might need to use some community mental health services. And so you see how they're kind of all over there is no coordinated
And if
care
you're
model.
in something the size of Chicago or Atlanta, those exist. If you're out in the middle of nowhere in a little community, no.
Right. And that's where telehealth is great. And it has opened doors as long as they have access to to broadband. So they can do that.
Right.
Yeah.
Yeah, I know Amazon has medical telehealth. I'm just curious. This squirrel. Do they have Amazon has medical telehealth? Do they have mental health telehealth?
I honestly
I
don't
have
know.
no idea. See, like I said, squirrel. Um, but yeah, I mean, we just don't know, and so then because we don't know, we don't do anything. I had a guest on one time, and she was talking about human trafficking.
Mm.
That's and it was really bizarre how we were actually able to make it pertinent to business, right? And the way it was you travel a lot for business. You're
Mhm.
going to see something. And it's the old if you see something, say something. And and her point was you can always apologize if you were wrong. But what if you're not wrong?
Right.
And I remember that. And now, that whole human trafficking thing still freaks me out, but I do think of that. I'm like, does this look a little unusual? But same thing. I mean, and I think in many cases we get a feeling, right? And something feels off. And we ignore that because we're scared of it. We don't know what it means. It's time for us to leave work for the day, whatever it is.
So I think there's a little bit of it's not my problem
Mm-hmm. Oh, yeah.
that's out there right now.
Mm-hmm. Mm-hmm.
Um, oh, for sure. And you certainly, I think we actively
Mm-hmm.
in business
Mm-hmm.
discourage, right? Because you don't want the liability of I knew something and I didn't do anything about it.
Mm-hmm.
But what I do know as a boss, as a leader, as someone who receives calls right to my organization, is that it takes a lot of courage for somebody to ask somebody for help. And I would hope that whoever they chose
Mm-hmm.
is able to
Mhm.
to say,
What can I
okay,
do? Mhm.
right, not I need you to call HR.
Mhm.
That's definitely risk management,
Mhm.
but I don't know that the person is actually going to now
Mhm.
call someone they don't know
Mhm.
and share this intimate
Mhm.
detail of their life.
Right.
So
Mhm.
in Janelle's world,
Mhm.
um, every single person who has supervisor, manager responsibilities, as well as every single teacher,
Mhm.
coach,
Mhm.
has basic mental health training
Mhm.
because they're the ones who are in the front lines. They're the ones with the relationships.
Mhm.
They're the ones who are going to know if something is going wrong or not.
Mhm.
Now, listen, my team, my managers, they know
Mhm.
exactly how their team members are doing just based on how they walk down the hall.
Mhm.
Don't expect that, right? But I do expect
Mhm.
a certain level of I've received your sharing and
Mhm.
let me help you get to the right
Mhm.
place for you.
Right.
And that could look different, but we don't have we're back to we don't have
Mhm.
the care navigation knowledge
Right.
that any of us need to understand, ooh, what's my level of severity? Like how severe are my
Right.
symptoms?
Mhm.
And what does that mean for where I need to access
Mhm.
or find care?
Mhm.
What does that look like? Because it
Right.
could be in a program, it could mean the emergency department, it could mean just psychological testing, it could
Right.
mean outpatient therapy. People don't know. And then they don't know how to go about finding it.
Right.
Um, I think the number one thing is it's how you pay for your care
Right.
that is
This
going to
is not cheap.
determine, well, it's going to determine what your options are.
Right.
And so if you have commercial, employer-based insurance, that's probably one path.
Mhm.
If you have any of the Medicaid
Mhm.
products, it's another path.
Mhm.
And if you fall in between and are uninsured or underinsured,
Mhm.
if you have one of those high deductible plans that you're never going to meet the deductible, let's be
Right.
right, then what do you do? How do you navigate that?
Mhm.
Because if you're not using insurance, care is really expensive
Mhm.
every week.
Mhm.
And I gotta tell you, sometimes you need 12, 20 weeks to really get at
Right.
those underlying
Mhm.
problems and make those long-term
Mhm.
changes.
Right. And again, we don't blink at medical care.
No.
I have been receiving treatment for 10 and a half years. Now, I'm really, really lucky. We have very good insurance. I hit 2 million within probably 2 years. But that was because I had complications. My insurance has denied one thing. One. The entire time. And now I know I'm very, very fortunate with that. But, I also know if I go, I got this, whatever it is, I get treated immediately. But if I were to, but they ask me the questions, right? Every time I go in, you get the, have you fallen recently? Have you done this? Have you done that? But I also get the, have you wanted to harm yourself question. And I don't know if that's a practice at my practice or if that is something, but, but the funny thing is, there are times where I'm like, if you pause wrong, they're a little concerned, right? And I'm like, I just felt really crappy. And some days I'm not sure how I'm going on. That's very different.
Yes.
But yeah, at least they're asking. And,
Yes.
And I did ask one time, I said, so what happens if some of these questions are answered a certain way? And they said, well, it's a big practice. And they said, we do have social workers on staff. And they said, and if the social worker isn't there, excuse me, then the nurses get to deal with it. And my nurse said, I am not trained to do that. She said, now I will try. And one of the things she said was sometimes they just need somebody to listen.
Mm-hmm. Yeah. That's why a lot of those 988 calls are resolved over the phone.
Right. Yeah. Because it's not serious. It's not a crisis. And, and then maybe you do need further assistance, but it got you over that hump. And I think that's the thing is, sometimes it really is just sitting and listening to somebody.
Yeah. We handle things a little bit differently in our practice. So when you call in and you're wanting services, our scheduler says yes. And she schedules you to come in for an assessment. We do the assessment. And that gives us all the kind of information we need to triage, get you to, if we're not in the right place, get you someplace else or whatever. So she had a parent call in who was very anxious about their child and very anxious. And she had been calling around and all kinds of wait lists. There are not a lot of people who deal with kids under the age of 12.
Right. That's a
Right.
totally different.
Right. So we do. So she got us and Betsy said, yes, no problem. Would you like to come in first thing tomorrow morning at 9? And the one was like, yes, I would.
She's like, wow.
So the case manager, sort of assessor person walked in and we're like, you have a 9 o'clock. She's like, okay. You know what? An hour and a half, brought down the anxiety of mom and kiddo. And they got some coping skills, and then they were able to talk through this, but they're like, oh, this isn't a crisis.
Wasn't as scary as we thought it was.
Right. Right. Yeah.
Right.
But I think there was this big debate 10 years ago. Do we do screenings? And then if we do screenings, but we don't have any place to refer people, so that's a reason we shouldn't do screenings. So then they were doing screenings. And while it's true, there is not a robust referral network because we're still waiting for the great community mental health system that was promised and envisioned in the 60s to develop. And it's not there yet, but we have a workforce shortage. Here in Illinois, the workforce can only address 24% of the need.
Wow.
So take what we know about the number of people experiencing mental distress, emotional distress in a year, combined with that statistic, and chances are, and we don't have good screening, we don't have good public awareness. Right. People are not doing well, and no one's talking about it.
Well, and that is where then we get the violence, we get the suicides, we get all of those things because they've just reached their breaking point.
We get that, but we also get a lot of performance issues at
Mhm.
work,
Right.
absenteeism.
Mhm.
I mean, just because you're having a mental health crisis doesn't mean that you're violent or you're going to
Right.
harm yourself.
Right. Maybe
You
you just can't get out of bed.
exactly,
Mhm.
right?
Mhm.
So it shows up. I mean,
Mhm.
I have always, the entire time I have worked here at YFC,
Mhm.
known and said that disability is the number one, or mental health is the number one disability,
Mhm.
right?
Right.
And it is bigger than
Mhm.
the other ones combined.
Right. We're
And
calling in sick, I'm putting that in my little air quotes, when we aren't physically sick.
correct. We're maybe not, and listen, and I think
Mhm.
of sick time as a leader,
Yes. Mhm.
that is
Mhm.
that's different than respite care. That's different than vacation, right?
Right.
Vacation you should plan
Mhm.
and you should use
Mhm.
to recharge
Right.
and to right to give yourself
Mhm.
respite throughout the year
Mhm.
so you can sustain. But sick is if something goes awry,
Mhm.
right? And you need to, and that could be yourself, but it also could be
Mhm.
someone you care for.
Mhm. Right.
And I wasn't surprised to see some of the stats come out about workplace medical leave,
Mhm.
about how it's increasingly for mental health,
Right.
and how the most, well, I guess the populations where that is, they're seeing that the most
Mhm.
is in millennial and Gen X women.
Mhm.
That is no surprise to me
Yeah, it
because
doesn't surprise me either. Mhm.
Gen X, that's
Mhm.
me, right?
Mhm.
We are in the sandwich generation. And the millennial women, I think their kids are probably early adolescence
Right.
where things start to really go
Mhm.
haywire,
Mhm.
right? And so even if it's not their own mental health,
Mhm.
women, like what happens when your kid, for example,
Mhm.
if your kid is having a crisis,
Mhm.
you're not going to work.
No. Uh-uh.
You're not
Mhm.
probably even working from home. You're probably
Mhm.
called in sick
Mhm.
and you're probably on the phone trying to
Mhm.
get them in somewhere,
Mhm. Right.
right?
Right.
So I think, yeah, it's
Mhm.
a problem.
Mhm.
It's showing up all over
Mhm. Right. Yeah.
schools, workplaces.
Yeah. Oh yeah. And like you said, absenteeism, the kids that go to school and I mean, I went to school with kids that you knew there was something, but this was long enough ago that we really had no idea. And but and there were other things. I mean, like, I know that I went to school with kids that were abused, right? I remember one time when we were in PE class and one of my classmates took off her shirt in the locker room and her back was just this crisscross. And I don't know, we were probably junior high, enough that it freaked us out, right?
Yeah.
And and part of it was it was very sad that that was, you know, she didn't think anything about taking her shirt off. But we of course, we raised the red flag, but that then of course caused mental health issues for her. Because she'd been told, you're horrible, you're awful, you're no good, all of those things. And I think that's one of the other things that so many people forget is there are physical and mental tie-ins in a lot of cases. That and so we deal with the physical part and we forget that there's going to be something that is a mental health issue also.
Yes. And I think, of course, physical health, mental health are
Mhm.
so related.
Mhm.
It's hard to separate. Also,
Right.
well,
Mhm.
you have to rule out a medical issue,
Mhm.
of course,
Mhm.
but oftentimes those panic attacks,
Mhm.
people think they're having a heart attack. They're
Right.
really
Mhm.
having a panic
Mhm.
attack.
Mhm.
So, and we see like, people who have had
Mhm.
cardiac arrest and they're in that recovery period. Okay, we know they're at significant
Mhm.
risk for depression,
Mhm.
right? So why don't we just
Mhm.
put them on an antidepressant as part of the protocol?
Mhm.
Right? Like let's just
Mhm.
not even go there.
Mhm.
Um yeah, I think
Mhm.
we can do so much
Right.
more.
Right. And now correct me if I'm wrong on this. With some physical things, there could be absolutely no signs, and then boop, right, like a heart attack. A lot of those things. But my impression of mental health challenges is that they kind of build. Now, yes, there are some where every once in a while it is a chemical imbalance and whoop, right? But, it starts off with, and progresses, and we ignore them. Because I always, I'm from Colorado, the land of Columbine, right? We just celebrated that anniversary not long ago. And I will always remember Columbine. I mean, not only was it the first, I knew people. And I still remember the parents saying, we had no idea. And I remember thinking, how on earth did they not know there was something going on? But it comes back to what you were saying with like the workplace, right? We don't want to admit that there's something that's happening.
Yes. Right. And I think my husband's a high school teacher. So we talk a lot about schools and
Right.
safety because it's such a thing. And I also think that the key is belonging. And oftentimes I think the kids where we're seeing them act out, they don't feel like they belong. And you could say the same thing for adults. And so this need, it comes back to for good wellness, right? You need to be able to love. You need to have be able to work, to have purpose in your life. And you need to be able to play and have, so and when you can't and don't have all those things, something's out of balance. And, yeah.
Right. And we see the people in the workplace who always sit by themselves, who, and now granted, I mean, there are sometimes that is perfectly their choice. But, what would happen if you went up and sat down
You were
and
just
said,
kind.
yeah, hey, do you mind if I sit here with you? Now, I mean, they could say, go away. Okay. But maybe they've just been waiting for somebody to say, hey, can I join you? And I think a lot of that, it does go back to junior high and high school where we were trying to fit in.
Of course, but that's natural, right? We
Right.
want, that's totally age appropriate. You just want to be part of the pack.
Right. But, you're new in the office. You're new. Oh, I don't know why this just popped in my head. I'm a Big Bang Theory, and one is Sheldon's thing. He reads the book New at the Zoo. Right? She's trying to make friends, right? And the whatever is new at the zoo, but it is like that, right? We're new at whatever it is, and and it's really fun. I am one of the most outgoing people, extroverts in the world. I don't make friends easy. I just don't. And now I'm an only child. And so maybe that's where that comes from. So I'm not the person that's going to go in and plunk down at the table with everybody else and all of those things. But I might also be the person that sees that one person by themselves and go over and say, hey, do you mind if I join you? I'm new here. Can you give me, some information or whatever?
We had a lot of turnover here at YFC in the pandemic and immediately following, like everybody else, right?
Everybody did.
But that caused us to look at our onboarding and our orientation of new staff members. And what we do now, which I think makes a huge difference, is when someone comes and joins us for the first week, we have every minute planned out for them. But in there, we have lunch dates and we have people checking in and spending time with them. And our number one goal for that week is for them to feel like they belong here at YFC.
Right.
I don't care if they've retained any of the information, but I want them to feel like I found my home.
Right.
Right.
Yeah, and we don't see that in companies. I mean, you're doing good if your manager points you towards your desk. And, and just imagine, what the turnover would rate. Like you said, if people were made to, and I don't care if they're just making widgets, right? If they know that their widget brings value to the world, then that's okay. But we just ignore people, and that then leads to the other big workplace issue, and that's burnout. We just get so tired of having to do it over and over again. And I think people don't stop and think how hard that is on our mental thought process I'm not saying that it's a mental health issue, but it is something that is hard on us. But we ignore it in the workplace.
Not here.
Yay.
Not here. Listen, this is a really high burnout field, and I need my employees to stay because
It's stressful.
it is very stressful. And they listen to stories sometimes. Well, they listen to awful stories all day long. Yes, they're trained. Yes, we tell them not to get in the pool, stay on the pool deck, walk alongside, but it's hard. And I need them to be able to come back the next day, the next week, the next month, the next year. So one of the things that we did, we started this back in 2024. So we said, we have to go all in with retention. We finally got a great team and man, we got to keep them. So for us, that looked like raising their salaries because as a nonprofit, right, we're caught in that scarcity mindset and we don't pay market. We took a lot of time. We looked at market rates. We developed a plan. And I was fortunate enough to have a donor walk in the door and say, I want to move the needle. What would move the needle? And I said, how much? And he said, well, 6 figures. I'm like, you can move the needle for 6 figures. And I came back and I said, salaries.
Right.
And
because most people want to fund programs and services.
That is my program, is my people. And he's like, well, it wasn't that I had in mind, but he and his wife were very savvy donors and accountants. I walked them through my logic and they're like, let's give it a try. So we raised salaries, but we did other things too. Right? We improved benefits. We talked about them, made sure people used them. We went all in with our manager training. So we went all in with making sure our managers were cared for and were trained to care for their employees. And we figured out manageable work. So we took the time, and I've been working on this for about 15 years. I think I finally have it right. We went back and we did time studies. We looked at, how much money do we need to bring in the door from each person? How much time do they have? How long does it take to do tasks? And we came up with the productivity logic model. And so we said, okay, based on where you are in your development, how long you've worked at YFC and know how to do things the YFC way, we're going to say we're going to set your goal, your productivity goal. And if you don't meet it, that's a problem. But if you do meet it, we'll reward you with a bonus, with a cash bonus.
Right.
Well, we started to see the first results in 2025, about mid-2025. Retention had not completely stopped because I had some people say, I'm out. And done. I'm out. Okay, that's fine. But we started to see, right, more client sessions. So at the end of the year, by the time we got to the end of the year,
their productivity went up.
1,500 more client sessions, and of course, more income for the organization, but also more clients were completing their treatment. And I know that when the clients complete their treatment, they meet their treatment goals.
Right.
And so, yes, that went up, right? That went up. So now we have happy clinicians. We have clients that are able to complete their course of treatment. And we have better outcomes, which is what everybody wants.
Right.
And that all came from pouring into the staff. Right. So it's been it's been a joy, actually, to work with this donor couple and sort of track our progress.
Right. And really show them the difference that they've made.
Yeah, because it's huge.
Right.
It is huge. And that means so much for that client who wants to stay, they have, listen, we make it affordable, but they have to want to, they've got to connect with their provider. Right. And so, there are lots of reasons people come into therapy. You don't have to be broken.
Mhm.
I tend to say we're helping people cope with life transitions.
Mhm.
Right? So things are, they're
Mhm.
rocky, or you
Right.
anticipate them
I mean,
being
it could be
rocky.
something as basic as your kids have gone to college and you don't know
Yep,
what is your purpose in life now.
exactly. Right.
Mhm.
So life
Mhm.
transitions, I would say there's always that um, you could be healing from a trauma, right? That you
Right.
didn't know you had, or maybe you did know it, you
Mhm.
had it. Oftentimes it looks like, gosh, this is the umpteenth relationship that
Mhm.
hasn't worked out.
Mhm.
And then when you do, and you peel back the
Mhm.
onion, there's an aha moment
Right.
of something that happened a long, long time
Mhm.
ago.
Right.
And then you can begin to do the work. I remember one clinician, she'd been working with this client for 2 years,
Mhm.
peeling back the onion. And she came out after the client had left her session, and she said, I just found out why. I just got at the trauma.
Mhm.
She just took her
Mhm.
2 years to tell me.
Wow. Mhm.
She goes, now we can begin the work.
Mhm. Mhm.
But thank goodness
Mhm.
that clinician,
Right.
right, was here.
Mhm.
And then, there's,
Mhm.
yeah, for example, in my family,
Mhm.
my son is ADHD.
Mhm.
When we figured that out,
Mhm.
right, that
Then
was
you
a
know what
whole,
to do.
well, I knew I had to do something
Mhm.
different, but I didn't
Mhm.
know what it looked
Right.
like to parent an ADHD kid. So I went and got therapy
Mhm.
and got
Right.
coaching on how to
Right.
meet
And
his
it wasn't
needs.
anything you did wrong.
No, no.
Mhm.
And today there are great tools out there, right? There's
Mhm.
screening
Mhm.
tools.
Mhm.
We've got one on our website. Mental Health America has
Mhm.
one. You can ask your physician,
Mhm.
right? Hopefully
Mhm.
they're screening.
Mhm.
But I would say if anyone's ever in doubt, just ask somebody,
Right.
is this normal? Literally what we asked when we went into the neuropsych for my
Mhm.
son's ADHD testing was,
Mhm.
we're like, we have 2 girls and now we have this.
Yeah.
So we don't know if this is just boy
Right.
or
Yeah,
if there's something else.
Mhm.
And he laughed and he said, well, let's figure it out.
Mhm.
And so, yeah, he's like, yeah, a boy and,
Mhm. Mhm. Right.
right? But then I left
Mhm.
with this great information about
Mhm.
my kiddo
Mhm.
and how
Mhm.
I need to work
Mhm.
with him so he can succeed.
Mhm. Right.
It's just
And
coaching.
and the biggest thing that I got from what you said is that continuity, right?
Mhm.
That one person had the same clinician for 2 years. Just like we don't like to change medical doctors. I
Or
you know
hairdressers.
Yes, I don't want to have to tell them again, this is the side I part my hair on. This is, the thing that I had done 20 years ago. No, I want that continuity. I told somebody one time when they were going to make me change gynecologists. I'm like, "Oh, no.
No, no,
No,
no. Right. No, no, no. Yeah.
yeah." And I mean, I have had the same cancer doctor for 10 and a half years.
That's amazing. You don't have to tell your story
Yeah.
again.
And when I have to get a different doctor and I have to tell my story, I get really annoyed. And of course, it's and so then I get annoyed with him. First of all, because I'm just expecting that they will have read my mind and they will have read the charts. And it's like, no, and so, and that's for your basic, your your basic physical health. And back to what we were saying at the very start, the mental health issues, we don't want to talk about them. And so you change clinicians on somebody and they're going to go in and how you doing? I'm fine.
Right.
Right? They don't want to go through, especially if it's traumatic, if it's hard, if it's soul wrenching.
Yeah.
They don't want to go through that again. I mean, who
Right.
would? And so the fact that you have continuity of care is absolutely incredible.
So at YSC, we firmly believe that coverage
Mhm.
isn't access, right?
Mhm.
Access is more than coverage.
Mhm.
It's
Mhm.
finding a provider who looks like you, sounds like
Right.
you, right?
Yeah, me talking
Speak
to
your
a big
language.
burly dude is not going to work very well.
No.
Mhm.
So we had, and we go out into the community to
Mhm.
where the people are.
Mhm.
And at one point, I had a provider, and he
Mhm.
was working with a very low income population. And he had one guy come in and say, it's a different person
Mhm.
every time. I've told my story 5 times.
Mhm.
And my provider said, let's stop there for a minute. I'm really sorry.
Mhm.
Can we make this be the last time?
Mhm.
Let's try to get that done.
Mhm.
But the reality is there's all sorts of things that come up
Mhm.
that prevent people from, how can I say this? Um, totally completing their treatment. So I like to think about
Mhm.
the whole treatment like a meal.
Mhm.
And there's there's the salad appetizers, and there's the entree,
Mhm.
and then there's the dessert.
Mhm.
And sometimes I'm ravenous and I stay through the dessert.
Mhm.
But a lot of times, especially as I get older,
Mhm.
I just want the appetizer.
Right. Or I
Right.
eat dessert first.
Well, yeah. Yeah. So that happens to clients too, but
Mhm.
for lots of different reasons.
Mhm.
Um, you know, they don't want the whole entree. They just want the symptom management,
Right.
right? But isn't it lovely
Mhm.
when, for example, we work with an elementary school aged
Mhm.
child on skill development around
Mhm.
something,
Mhm.
but then they go to middle school
Mhm.
when then things are a little bit different.
Mhm.
Isn't it lovely when they can come back in, work with that
Mhm.
same provider?
Right. And say, I'm
And
in 7th grade now, and oi.
I need a different set of skills.
Mhm.
I need more. I need
Mhm.
more age appropriate
Right.
ones.
Mhm.
Right. And so
Mhm.
that
Mhm.
happens a lot
Mhm.
where people, they don't,
Mhm.
they go away, but then they want to come back.
Mhm.
We call that
Mhm.
episodes of
Mhm.
treatment.
Right.
You
And that
know?
happens.
Yeah.
Mhm.
You don't want to have to retell your whole
Mhm.
story.
Mhm. Right. And just having that person who understands you, many years ago, and I worked for the American Cancer Society in Denver. And one of the things we did, we had mobile mammographies, right?
Mhm.
And for some reason at that point in time, and still might be, there is a large Russian population in Denver.
I did not know that.
And yeah, it's very strange. And so, off trundles our big mammography center, and we sent Russian translators.
Yes.
And so these women who had never had a mammogram, who had, you want us to do what? They had somebody who could talk to them in their own language and were women, right?
Mhm.
And so yeah, just that simple thing. And the reason I remember it is I got a phone call from a daughter. And she said, we found mom's cancer because of you. Thank you.
That's amazing.
And and I don't know if that still happens. I have no idea, but was it complicated? Yes. Finding Russian translators who could speak medical ease, so that was a
Yeah.
totally different language,
Yeah.
and have that counseling. I mean, all of that in there. It was definitely a challenge. And so what happens with all of this is it's too hard, so we're not going to do it. Or worse, it's not my problem, like you said, and so we've got to get over that, folks. We've got to be saying this is all it's not problem. These are our challenges to solve.
Right. Well, and I think that it's we know what's going to drive good good care outcomes, good client patient outcomes. And it's not always something that can be solved on a systems level.
Mhm.
But I do think increasingly
Mhm.
we organizations we're middle class constructs,
Mhm.
right? We're trying to push people into systems. And maybe it's like a
Mhm.
square peg in a round hole. It doesn't
Mhm.
fit, but is that
Mhm.
what's best for the client?
Right. Right.
Right? I had a
Sometimes
clinician
it's the only option. Well, then maybe we would try and make that square peg fit. But yeah.
yeah. I had a clinician in my office earlier today, and she was just sharing about a case.
Mhm.
And there is a client who can't afford to come every week.
Mhm.
He can't. He has insurance, but he can't afford um, the copay,
Mhm. Mhm.
and so he's going to go down to every other week. And she was saying how that just doesn't. He's going through a lot, and
Mhm.
she's really sad about that. And not good for YFC, but
Mhm.
we are a nonprofit. We have philanthropy funding
Mhm.
to do just this.
Right.
So what's best for the client?
Mhm.
Can they take them off,
Mhm.
have them decline their insurance benefits if we put them on the sliding fee scale?
Mm-hmm.
Can you afford to come every week?
Mm-hmm.
Like you can, and I basically just empowered her to have that conversation and do what's best for the client.
Mm-hmm.
But that I'm only able to do that because we're a nonprofit and we have significant philanthropy
Right.
that is basically filling that gap and allowing us that ability to say yes to someone who can't afford it.
Right. And how many times is somebody told no, either for mental or physical health type of things?
All the time.
Yeah.
All the time.
Mm-hmm.
From that first phone call.
Mm-hmm. Right. Right. And I remember, talking to somebody who had no insurance at all and needing medical care. And I said, actually, you're probably better off than if you had medium insurance because you have no insurance. Therefore, you will get full government coverage for what she was needing. And I said, it's the people in the middle. Exactly. They can't afford their copay. They've got a high deductible. All of those various things are what stop them. And
Yeah.
And I mean, the system's broken. We know the system's broken, and it's not. We're not going to be able to fix it, but we can talk about it.
But it's a shame that we can't fix it because access to mental health care is not world peace.
Right.
It is a solvable problem. We just don't have the will, and no one's willing to put the funding. So, that's what we're trying to do here in our little corner of the world is solve that problem for our community. I just wish it could happen on a bigger scale.
Right. And I mean, that is the bad thing is you're not worldwide. You're not even outside of Illinois.
No.
But I mean, that's okay because, you're doing very well for the people that you are able to serve. And I think sometimes when we grow, we get too big.
Yeah, for sure. For sure.
The levels come in, and so, but all this comes back to, we have to have those conversations. We have to talk to people, if we're in the workplace, we have to say, hey, wait, why don't we offer this? Hey, can we have a happy break every day? I knew somebody who did that. They had a happy break every day. And the office stopped and they got up and there were no excuses. It was not, I have a report, I got a call. No, you got up and it's kind of like at church, right? When you all turn and you bless everybody, right?
Yes. The sign of peace, yes.
Yes. And so, they were doing this in the office and, they got lots of eye rolls. But the people who were doing the eye rolls and the were also the people that, wait a minute, we've missed that today. Right?
Right.
Yeah. And so again, simple things, watching out for each other, saying something, and really sometimes it is simply a matter of saying, is there anything I can do? Can I help you? I tell people, don't be too generic because we can't get our heads around that. When I was very sick and people said, can we help you? I went, well, thank you. That's very nice. But I couldn't come up with anything that they could do. But if they were specific, then I could go, oh, that works, or oh, that doesn't. And, and so this is, can I sit with you? Yeah. Can I just listen to you? Can I just sit? And sometimes that really is, we want to know that we matter. And a lot of times we don't feel like that. And somebody just sitting there, not saying anything, that's okay.
Yeah. I think there's so many things, especially as business people, that we can do to be that spark. And and you can certainly be a leader at any level in any organization. But I also, if you're in HR, right, be informed, right? Understand what when you're choosing insurance, look at the mental health benefits.
Right.
Right.
And it's not just employee assistance program. I shouldn't say it that way. That is a very important thing to have in there. But what does that entail?
Well, and what does if you've chosen, for example, United Healthcare,
right?
What are their networks closed? Are they open? Are they how many
Mhm.
sessions do they
Mhm.
cover?
Mhm.
Those are there providers in your area?
Right.
Here in Lake County,
Mhm.
over 50% of the mental health and substance abuse providers are out of network.
Ugh. Which means they don't get paid for.
Well, it means that if you have insurance, you can't use it.
Right.
So I want the
Mhm.
HR people to know,
Mhm.
right?
Right. Yeah, maybe you can
Choose,
get to 75%. I.
right?
Mhm.
And we need our systems to change. We need reimbursement rates to change.
Right.
We need,
Mhm.
so many things. Education to
Mhm.
change.
Right.
Janelle's world looks really different
I know.
than the world we have today.
Yeah. But there are things that we can do today. And so,
Absolutely.
oh my gosh, we are almost out of time. But I want to know, because we do have listeners who are in your area and other people who might be going, hey, we could do that, in our area. So what are the services that you provide?
Yeah. Here at YFC, we do the outpatient therapy, but we also are working on those systems level barriers. So we're working to develop the talent pipeline. We're trying to grow and strengthen and diversify the workforce. And that's something that I think anyone can get excited about. We have a program for high school students. It's on Zoom. Anyone in the country is welcome to join and listen in. We also believe that we need to do our bit about providing information and knowledge to our community about the behavioral healthcare system so they can navigate it effectively. We'll be launching our new website in a couple of weeks, and we'll have what I'm calling an atlas, old school book of maps, but each map is a different level of care. So you have outpatient,
Okay.
right? The higher level of care all the way up to crisis care. What does it look like? What are the goals? How do I find the right provider for me? It's not a directory, it's knowledge.
Right.
And again, there are tips on how to find providers that might apply more to people in Illinois, but that general systems knowledge, it's pretty universal.
Right.
And so I do think that, yes, we're local, maybe regional in Lake County. And I think if there are people who want to move the needle, are interested in these things, I'd love to connect with them. And they should feel free to use our services because sharing is caring.
Right. And you have great resources on your website, no matter where somebody is.
Yes, for sure.
I
Yes.
love it. I love it.
Thank you.
Well, oh my gosh, this really has been so interesting. Usually I say fun, and it actually has been fun, but it's been very interesting. But more importantly, it's a discussion that needs to take place. It needs to take place everywhere and often.
Wouldn't it be great? And I'll just leave with this question. If instead of like publishing the SAT scores for schools, we publish the number of hospitalizations for mental health, or instead of publishing, employee benefits, you published how many people take leaves. I'm just saying, I think we need to be curious.
Right. And go, wait a minute, why is that number so high? And of course, the thing is, how many people are not on those lists that should be?
Correct. Correct.
Right.
That's a whole nother conversation.
Yeah. Oh, yeah. Yeah. Well, oh my gosh, I've been having so much fun. This has been such a great discussion, definitely thought-provoking. And, and I think we should have you on again to continue this discussion because it is very important. But until then, do you have any final thoughts that you want to leave everyone with?
I do. I love your call to action of be the change, right? Yes, there are whole systems that have to move, but also one person can have incredible power just by listening and asking if someone's okay. And if you're scared about that, call 988 and ask, how do I do that? So be the change.
Oh my gosh, I love it. I love it. Well, I have been having such an interesting discussion with Janelle Miller Moravek. She is the Executive Director of Youth and Family Counseling. And until next time, everyone have a great day.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.